Hello, my name is Dr.Kenshi, and I will be taking care of you. So, what is it that I can do for you today? Yes, I'm starting to remember now. Just give me one moment. Just check my schedule. Yes, you have booked an eye exam. Is that right? Cool. So, is this your first eye examination? Have you ever been to one before? No? It's okay, no worries. Since it is your first eye exam, do you want me to explain you briefly what's this all about? Okay, so basically this eye examination is about checking the health and condition of your eyes and your eyesight, just to look for any early signs of any eye diseases such as glaucoma, and just to look for any changes in the prescription. And this is just a basic vision test. So we're going to start with your personal information. So what I'm going to do now is just collect some information about you and about your medical history, and also just ask you a couple of questions about your eyes, okay? Okay? Very good. Okay, so we're going to start with your names. Okay? You don't mind if I get up close to you? Okay, very cool. Okay, and your age? Okay, and is there any previous medical history that I should be aware of? No? Okay. So, some questions about your eyes. How long do you stay on the computer? Yeah, I can totally understand that. And do you wear any glasses or any contact lenses? Okay. So, do you have any family history, maybe from the male side or female side? Do any of your parents wear glasses or contact lenses? Yes, I understand. Okay, now that I've collected some information about you, we can start with the examination. Basically, just a series of tests just to check the health and condition of your eyes. Okay, let's see. Okay, so the first test is just some color test. I want you to guess what is the number here on the list. 12. Perfect. And can you tell me what is this color? Orange. Yes, just like mine. Sure. Correct. This one was easy. Here's the next one. Can you see this number? Can you tell me what is this number? 27. Very good. And what are the colors? You can tell me, of course. Red and yellow. Perfect. This one was also easy, but there goes a hard one. Okay, so can you tell me what is this number? And after that, if you could tell me the colors on this list. 74, that's correct. Impressive. So now can you tell me the colors? Yes, that's right. How about these colors? Yeah, they are different, so be careful. Okay, very good. That's correct. That's pretty impressive. Most of the patients actually think on the last test that's 71, but that's not 71. That's actually 74, which you guessed right. And I'm really impressed about your vision, about your eyesight. So next is just a regular vision test, the so-called Snellen chart. So right now, I want you to follow my instructions and tell me. We're going to start the letter from line number 1, okay? Yes, this one is really easy. E. Okay. Next is line number 2. Okay. Very good. Line number 3. Okay, now you could just take a few steps back and tell me line number 4. Okay, now take a few steps at me, closer. Tell me the letters from line number 5. Okay, very good. Correct. Now I want you to cover one of your eyes and tell me line number 6. Okay, very good. Perfect. Correct. Very good. Now cover your other eye and tell me line number 3. Okay, very good. That's very impressive. Once again, you never cease to amaze me. As your first eye test, I have to say, so far I'm really impressed from your results, but there's more tests to do. Okay. Okay, so now the next step, what I'd like to do is just inspect your eyes, just have a closer look with this flashlight. So I'm just going to examine your eyes just to check for any signs of any eye problems, okay? But first, I need to put some gloves. I just forgot about them. Yes, they're latex one. How did you know? Sixth sense? Well, you're one of a fascinating person. Okay, now let's continue with our test. Now, I want you to look straight ahead, yes, at me, so I can do that and examine your eyes. I apologize if you hear any sounds from outside. It's kind of noisy today, but I guess people are going home from work and they can't wait to get home and relax. So I just want you now to relax and let me examine your eyes. Okay? Okay. Very good. Okay. Now I want you to close your eyes. I'm just gonna inspect your eyelids. Okay. Alright. Now just relax a little. Just try to pull them down really gently. Okay, now your other eyelid. Just check if they both function normally at the same time. Okay, now I want you to open your eyes. Now focus at my nose right here. Okay. I'm just quickly examining your peripheral vision. Okay, now I'm just gonna get up close to you. I want you to look up for me. Okay, very good. Now look down. Now look to this side here. Okay. And now look to this side here. We're going to repeat this exercise in just a little bit. Alright? Now just blink as fast as you can. Okay? Just as fast as you can. Up. Okay. Now, again, look up. Look to this side. Okay. Now look down. Okay. Now look to this side. Perfect. Okay, now I'm just gonna cover one of your eyes. Just look at this. Okay. Oh, you're alright. Okay, now I'm just gonna move the flashlight from side to side. I want you to just try to follow it, okay? Okay, very good. Okay, so far so good. Very good. Just like that. Now I'm gonna move again flashlight from side to side, but I'd like you to continue looking at me continually. Okay. I'm gonna switch hands. Just keep looking at me and don't pay attention to what I'm doing. Okay, now just want you to focus at this finger when you're using the flashlight. Yes, don't lose focus on the finger. Perfect. Now the other finger, the other side here. Just don't lose concentration. Okay, that's very good. Now, I'm going to examine your eyesight with my finger. I'm just going to do some movements just to check for any double vision. Okay. I just want you to follow my finger and just tell me if there's any double vision that we may find during this step. And change directions. Are any of these movements are comfortable to you? Okay, so just keep doing that just to look for any double vision that I may find. I'm just gonna go a little bit faster, okay? Just don't get surprised. Okay, so was there any double vision during this process? No? Okay, that's very good. Let me just fill out some information that we have gathered so far. This is really important. Okay. Alright, so now what I'm going to do is I'm going to examine your eyes with this flashlight. Well, I want you to focus on this pen here. Yeah, that's all you have to do. Just okay. Now, I want you to focus on this object once again. I'm just gonna move it. I want you to just follow it. Just like this. Okay, now just want you to focus at the pen for a few seconds until I tell you to stop, okay? Okay, so I'm gonna count the 5, then I want you to focus on this pen, okay? So here we go. 1, 2, 3, 4, 5. Now focus on the pen. Yeah, just focus on the pen right here. Just examining, just by having a closer look of your eyes, just to check if your eyes focus is functioning all normal and both of your eyes react at the same time. Also, don't pay attention to what I'm talking. trying to test your concentration of your mind, your eyes, just to see if they function all well. Okay, and again, focus on the pen, just watch it move around your eyesight. I'm just examining your ocular nerves. Your eyesight is playing a crucial part since it's one of the most important parts of the body because we visualize so much information through our eyes. So what I have noticed so far is that you have a little bit of a sore eyes, maybe from staying on the computer for too long. But I'll talk about it in a little bit. And again, just focus on the pen and watch. That's lovely. Okay, now I'm just gonna test once again your peripheral vision with my fingers. Won't you tell me when they leave your field of vision, okay? When you see them leaving your field of vision. Perfect. Very good. And again. I want you to tell me when you see them in your peripheral vision, okay? Like that. Okay, now I'm gonna wiggle them just to make the task easier for you. Okay? Okay? Very good. Now, what I'm going to do is the next step of examining your eyes with this flashlight. So, what I'm going to do now is just examine your eyes in a dark room, because for me, the environment in the dark room is much better for me to analyze your eyesight, and it is easier for me to look for any problems with your eyes. Also, just to test your eyesight in a dark space. Okay? Now, I'm going to turn off the light in 3 seconds, and then I'm going to examine your eyes in the dark room. Okay? Now, 1, 2, 3. Prepare yourself. Just having a nice close look of your eyes in this very dark room, which has really good environment for me to examine your eyes. Just to give me a general idea about your eyesight. Just like those color tests that gave me general idea if you're long-sighted or short-sighted. But what I can say is that your eyesight is very balanced, and so far I haven't noticed any problems with your eyes, not even an eye disease. This is just out of the question for me. There's no such thing as glaucoma in your case. Okay, I'm gonna do movements with my flashlight. I want you to follow this light, okay? And tell me if there's any discomfort in your eyes while you follow this flashlight. I'm just gonna move here. Okay, now I'm gonna move here. Okay, now tell me when you see the light in your vision, okay? Yes, that's like a light in the tunnel for you. Like you see a hope, a light. Yes, that's it. Now look straight ahead. Okay, very good. Now I'm going to turn on the lights in 3, 2, 1. Your pupils' reaction to the light in a dark room is very pleasant, and that just gave me general idea that your eyesight is functioning all normal in a dark space. Okay, next, let me just fill out some information that needs to be right down here. Just writing down this information here. So far, so good. Okay. So, last but not least, I'd like to give my conclusion about this examination. So, I didn't notice any imperfections, any abnormalities with your eyes. I didn't notice any changes in your prescription, or I didn't notice any signs of any eye diseases, not even early signs of glaucoma. So what I would recommend is that just try to go outside, ride a bike, just take a walk in the park, spend less time on the computer, unless it is very important, like work or something like that. And that's gonna be the examination. Just to sum up, just give your eyes a little bit more rest. They really deserve it. After all, they visualize so much information for you that you need. So sometimes they do need the rest they deserve. Actually, they need it always when it is necessary. Yeah, no problem. The pleasure is all mine. Okay. Oh, yes. Last but not least, do you want the results from your examination? Yes, of course, no problem. Could you tell me your email and telephone number? Okay, and your email? Okay. I'm gonna summarize the information about your eye exam, and I'm going to send you through the email, or if something gets wrong, I'm gonna call you. So you'll do whatever you need to do with your results from the eye examination, maybe for work or whatever you needed. So thank you for being such a great patient, and I hope you have a great day.